In the early 2000s, this group started out as Partners Together for Health. And then about 10, 12 years passed, and they changed the name of the JPS Foundation. The foundation was set up is to raise funds for the hospital, and we have 3 pillars of giving: to the patients, to the community, and to the team members.
Having a solid foundation such as the JPS Health Network is critically important to any growing community. You want to be sure that no matter what happens to you, particularly if you fall ill, that you, without a shadow of a doubt, have a healthcare home. And that's exactly what JPS finds itself being for anybody and everybody.
The foundation is not only just a grant-making organization, it really is a community-based organization that helps each patient, each family member, staff member, and community member as we move forward in the growth of Tarrant County.
You learn something new every day about JPS. It's amazing the number of programs and ways they help people. And so it's kind of you want to be part of it.
That's the importance of a hospital like JPS in our community, is that it is there for everyone and to meet them wherever they are.
We want to give the best care. This is the beginning of their lives, and what we do here in the hospital in the NICU doesn't just affect them for this hospitalization, it sets them up for success throughout their entire life. So, we really appreciate everything that the foundation does for us to help these babies grow and start their life off on a good foot and have a really good, healthy rest of their life.
They're an excellent advocate for what the Women and Children's Services needs. From step A through step Z, they're involved with us, of course, and the community. Where we see them the most often is meeting the physical needs of our patients. We go to them asking for assistance with items like baby clothes, car seats, pack and plays. Another thing that comes to mind is our mamas who have lost babies. I know the foundation has worked a whole lot with community resources to make sure those mamas are loved, cared for, and that the babies do have what they need as well.
A lot of people, after years of hard work and just life, end up with a lot of pain. Obviously, we have great providers and specialists here that can help them with some aspects of that. But when work is no longer possible or not as much work, then those things have to be filled in. There are some funds that are provided literally for direct assistance. And this is one of those opportunities, a very unique opportunity to help them when really no one else can.
Meeting people where they're at is so powerful and so important and impactful. That says a lot to people that are marginalized and vulnerable, that are used to being at the edges of society, and they feel what's worse is being invisible, is just not even being seen by society. And when we bring that care to them, they become seen, they become heard, they become validated as a person. And that I've seen time and time and time again, people being more invested in their own care and their own well-being because others are, because they're part of our community.
Every time we drop off things that the foundation provides, there's a smile. I have seen lives absolutely changed because of it.
We're here to serve a community, and we are a community. So there's that opportunity for everybody to participate in how we make this hospital and the foundation better, to lead to better health outcomes for the future.